And tonight we are talking about
tennis and golfer's elbow. So this is a really cool topic. Probably one of the more common conditions of the elbow, definitely tennis elbow. We've all heard of. The proper term, medical term, is lateral epicondylitis or lateral epicondylgia, whatever you'd like to call it. It's a very painful condition that will originate from the outside part of your elbow. And this is when the common extensor tendon, so this large tendon that'll attach right onto that bony surface on the outside of your elbow, becomes inflamed, usually due to repetitive repetitive motions, like at work where you're doing a repetitive action over and over again. Things like new sports like tennis, which is why it's very common on the backhand. So very, very, very common condition, and we'll be talking about this evening.
Yeah, so let's just do a little poll here. How many of you from the listeners here have had either golfer's or tennis elbow? In other words, pain on the inside or the outside of the elbow, or know of someone who has had golfer or tennis elbow, or maybe even had a surgery for it, or a release they call. So just give us a little thumbs up if you know of anybody, or if you're yourself has had tennis or golfer's elbow. Go ahead and give us a few thumbs up there. So the first one we're going to talk about is going to be lateral epicondylitis. Let's do this next slide. Lateral epicondylitis or tennis elbow. So there are two bony prominence on the elbow, one on the inside, one on the outside. They are called epicondyles. So when you feel the elbow, the bump on the inside and the bump on the outside, called the epicondyle. When it gets inflamed, we add itis at the end. So epicondylitis, medial, inside, lateral, outside. Inside is golfer's elbow. Outside is tennis elbow. Go ahead, Ben.
Yeah, so these types of conditions are very, very, very common. They call them tennis elbow because during the backhand in tennis, you'll put pressure on this outside portion of your elbow, where this common extensor tendon will need to pull on that bony surface. And what that will cause is little micro traumas, little micro tears in that tendon over time, which then leads to that inflammation. With golfer's elbow, it's due to this increased pressure on the outside of the elbow pushing in. It's called a valgus. And so when go right ahead, Clayton. Yeah.
No, I was just going to say, so the valgus stretch on the inside is when, if you took the outside elbow and brought it in, the ligament on the inside would be stretching, right? Mm-hmm. So same thing as a pitcher, when they go back, it opens up the inside part of the elbow. I just want to mention, Ben, so for those of you who don't know, a ligament attaches bone to bone, while a tendon attaches the muscle to the bone. This is a condition of the tendon that becomes inflamed. Again, you add itis, tendinitis. Golfer and tennis elbow are forms of tendinitis, right?
Yeah, for sure. And so these are both like overuse, muscle strain caused by repeated contraction of the muscle of the forearms. And these are caused by the muscles that are used to extend, and flex your wrists, right? And as well as move your elbow from flexion to extension. But more or less, it has to do with the muscles that are active in moving your wrist joint. And so it's definitely a very, very common condition. And you'll even have nerve involvement as well. And so a lot of people, us chiropractors, definitely look at the nerves. And so some people will present with conditions that are like tennis elbow, like golfer's elbow, when really you have entrapment of certain nerves. Namely, if we talk about the outside of the elbow, we have to be thinking about the radial nerve, because it'll pass right underneath that common extensor tendon there. And so you have to make sure that that entrapment site is cleared before you come out and make that diagnosis, because when you have a pin involvement or a radial nerve entrapment, it can really cause symptoms that are similar, but when you clear it up, the issue can go away pretty quick.
Right. So Ben, where would somebody have numbness and tingling if their radial nerve? So the radial nerve is right on top of the forearm here, And if there's a muscle that's tight enough, pinching that radial nerve, where will patients feel it on the hand?
So they normally will feel it on the top of the hand, and they'll feel it
Right.
into the first, like the thumb, the second, third fingers, and it'll sometimes even wrap around
Yeah.
to the kind of the tops of the fingers as well. But you'll
Yeah.
feel it all along the top of your hand, and you might feel like tightness and tingling and weakness there. So it's very common in tennis elbow to also have these types of symptomatology as well.
Yeah. So again, it spares, you're not going to have any in the palm. It's all going to be on the outside part of the hand. Now, that is usually involved and can mimic tennis elbow because it affects the extensors. And if you're overusing the extensors, and some people will get it because they're mousing a lot, right? So on the computer, because they keep their wrist up if their ergonomics aren't proper. So you get radial nerve entrapment. Now, the radial nerve can also be entrapped at the neck. So here again, as a chiropractor, we have to differentiate, is the symptom caused by something that's starting at the elbow? Is it caused by something that's starting at the neck? So many things will kind of lead you down the path. For us, Dr. Ben and I, we'll take a look, maybe an x-ray. And if there's a lot of crud on the x-ray and structural damage around where the radial nerve is coming out from, then we might have to treat this as a neck problem, even though the pain is presenting at the elbow. And many times people will say, why are you treating my neck? The pain is at my elbow, or I got numbness in my hand. Well, many times the presentation is going to be away from the cause of the issue. So that is one nerve entrapment. Now, when we flip the hand over on the inside, there's a nerve here that sometimes people call the funny bone, right? And people hit their elbow and their whole hand, not the whole hand actually, but the pinky and the ring finger go numb. And that nerve there is called the ulnar nerve. Go ahead.
Yeah, the ulnar nerve. So it's super important because when we talk about golfer's elbow, right, the issue on the medial side, the middle side of the elbow, these tendons here will get super inflamed and super tight. And if they are that tight and this ulnar nerve passes right underneath that medial epicondyle, it can impinge on that nerve, kind of like squeezing on a hose that's got water coming out of it. And so what will happen is you'll get that numbness and tingling down the side of the hand. And it's very common in people with golfer's elbow and medial elbow pain to have this numbness and tingling. And so some people will present and come in and they'll be like, oh, they've diagnosed me with golfer's elbow, but I've got this numbness and tingling down the side of my fingers. And I just haven't been able to get rid of it. And then what we'll do is during our physical exam is we'll go into the area, we'll palpate, and we'll go right into this tunnel here, this little groove where that ulnar nerve sits, and we'll just tap. And if the ulnar nerve is inflamed, it'll cause this referral, this patterning of pain down the forearm and into the pinky finger and half of the ring finger. And so part of the process as a chiropractor is checking, okay, is the entrapment site up in the neck, right? Do we have distribution here? Can we work through the neck and clear it there? Or do we have to work down into the extremity to help clear that issue up a little faster? And so that's one of the big distinguishing factors between, okay, do we have a true golfer's elbow or do we have a cubital tunnel syndrome, right? Cubital tunnel is where that nerve travels. It's that little groove. And so it's extremely important.
Yeah, totally. Very well explained then. So from a bird's eye view, when you have nerve irritation, there's two sources, either the spine, so spinal nerve irritation, or peripheral. Peripheral can be anywhere distal to the spine, shoulder, underneath the arm, wherever. And peripheral nerve entrapments are usually caused by muscles that are tight, pinching that nerve as the nerve pierces through that muscle. So over here, I'm going to just basically annotate this. This is where the ulnar nerve passes in what's called the cubital tunnel. And then it courses over here and supplies these two fingers. Okay. And what happens when these flexor muscles over here are really, really overused because of whatever you're doing, you create inflammation right where I drew this circle here. And now this nerve is irritated. Now, if you recall on another hump day conversation that we had, there was another condition that created numbness and tingling in the pinky and the ring finger. And that condition was called thoracic outlet syndrome. And that is a good example of an entrapment that happens closer to the neck where the nerves dive down and go into the arm. So again, the impingement could be from here, it could be from here, it could be in the forearm, it could actually be in the wrist as well. So we need to figure out where is the hose being kinked if there is a nerve presentation. Now, that doesn't happen all the time because many times golfer's elbow or tennis elbow will just appear as pain in the elbow. Doc, my elbow hurts right there. There's no numbness, there's no tingling. Those cases tend to be a little bit more direct and easier to diagnose.
Yeah, for sure. And definitely even speaking about different entrapment sites as well, making sure that you're finding that exact point of contact, whether it be in the neck, elbow, or in the wrist, crucially important in determining recovery. But as always, you know, starting at the neck is the best place to go because you want to be able to get to the source of the nerve and take as much pressure off of it as possible. And the neck is the best place to start. And just switching gears a little bit, the tennis elbow, we look at it the same way. As Dr. Roach mentioned before, making sure, checking, clearing the neck, clearing the elbow, clear the wrist, ensuring that we're getting all of those entrapment sites down to the main source.
All right, so guys, give us a thumbs up if you've learned something so far. We've only been talking for about 10 minutes, but how many of you knew that the funny bone was actually called the ulnar nerve? And that's what gives you that, you know, that funny feeling where, you know, part of your hand goes numb. That's actually the ulnar nerve, right? So I hope you guys are enjoying this so far. Give us a little bit of love, either a heart or a thumbs up. All right, so what do you see on an x-ray? Now, this is going to be far down the road. Like by the time you see this on an x-ray, you have endured a lot of pain, a lot of stubbornness, not wanting to get this treated, even though your wife said you should see somebody, or your husband said you should see somebody, you say, no, don't worry about it. And you keep shoveling or you keep doing what you're doing. And then eventually the tendon starts to ossify a little bit and you're going to start seeing on an x-ray. So go ahead, Ben, let's just point out what we're seeing here.
Yeah. So, I mean, I'd like to just point to the left x-ray first. And these are both just as a distinguishing factor. I want to talk a little bit about anatomy here because, you know, these look like two of the same things. Like, what am I looking at? How can I tell the difference between the two? And so if we could just get a cursor out, I'd like to just talk about the three different bones that we have here. So this is your elbow joint, and the top bone there is your humerus. And so your humerus runs right from your shoulder joint down to the elbow. It's the big, long bone there. And then to the side, we have the radius. And then on the inside, we have the ulna. And so the ulna is kind of this big bone here. It'll form the sharp point of your elbow. Now,
you know what I saw the other day?
What's that?
An olecranon bursitis. I don't know if anybody has ever had this.
Yeah.
Put your thumbs up here. I had one the other day that came into the office. It was a baseball on the end of the elbow. There is a bursa there. And he used to call it student's elbow because students study with their elbow on the desk. And the bursa gets inflamed. Boy, this guy had this mallet at the end of the elbow. And unfortunately, it's very painful. And many times they have to go in there with a needle and lance it, right? So that was one of the first conditions that I'd ever seen as part of like a student doing, you know, like athletic therapy and like first getting a touch into like medical, you know, sciences. That was the first condition that I've ever seen like in the flesh. And coming out of school, you think everything is a tumor or cancer. So you thought that was something growing that wasn't right.
Yeah. So just to return back to this photo. So yeah, we've got the humerus. We've got the radius and we've got the ulna. So the ulna again will make that giant bony sharp part of your elbow here.
Right
now, if we're talking about lateral epicondylitis or tennis elbow, we want to look to the lateral side of the elbow. And so the radius is on the lateral aspect of the elbow. And so if we do see calcification in the muscle, we have to look to the radius, the radial head, and look just lateral in the muscle belly. Now, Dr. Roach just pointed those out there, and you can see little white densities, radial opaque densities, just lateral to the humerus and the radial head there.
And there should be no white in muscles, no white in tendons. It's soft tissue. It's not bone. Only bone appears white. So if you're seeing white in muscle, you have bone in muscle. That is a problem.
Yeah, straight up, that is a problem. And so that's what we're seeing there on that image. And that is calcium deposits in the muscle, in the common extensor tendon, extensor ECRB, extensor carpi radialis brevis. And so that's in that particular muscle there, and you should not be seeing that. And that's on the lateral side. And they say, you know, up to 25% of patients with tennis elbow will present with calcific densities in the elbow if it's not taken care of early enough.
And like we said, you know, this is a chronic condition. Like this did not happen yesterday because you shoveled gravel and did some landscaping. Like this has been a chronic condition that went untreated or treated improperly. And there's been so much inflammation and chemicals from the inflammatory process that have infiltrated. And what happens, the body builds bone, because if it doesn't build bone, at one point, the actual tendon could detach from the bone. So it protects itself. So it actually starts to calcify the tendon and the muscle to make it stronger, because you're constantly pulling on it. You're not fixing it. So just get it fixed.
You know what? This reminds me a lot of the hump day conversation that we did when we were looking at semispinalis capitis, splenius capitis,
Yes.
people with extreme forward head posture.
Yeah.
And they had those limbus bones, like they had those bones, those calcific densities in the muscles and tendons, right?
Yeah.
So very similar.
Or even, yeah, the people that had that unicorn there on the back of the head.
Yes.
Is that what you're talking about, right?
Yes. Yeah. Same thing, like the enthesopathies and those giant horns, right? So the body is going to start to try to protect itself if you're not moving these structures enough. And this condition is very painful. So this individual must have had, you know, this tennis elbow for a little while and not had it taken care of.
Yeah. So on the right side, you want to point the right side?
Yes.
So this is the medial part of the elbow. So medial means on the inside. And on the inside, we have the ulna. So this is the ulna to orient you again. This is the radius, and this is the humerus. So over here, you can start to see these little white densities. Again, you don't see any white in soft tissue. White is bone. So now we have bone in muscle. Bone in muscle, no good. There's a problem there. So this is a condition that we would call golfer's elbow, because it's on the inside, tendonitis, or medial epicondylitis, all the same words. This is the epicondyle right there. The tendon comes up and attaches there, and it's become inflamed. And now didn't get resolved, and now there's some bony deposits that have started to form within that tendon.
Yeah. I mean, these conditions can happen, you know, to anyone who does any sort of repetitive motion, but they're most common in the fourth and fifth decades of life. Ultrasounds and MRIs are also extremely helpful, because that way you can see the soft tissue before it gets to this point, before calcific densities, you know, start to invade the muscle or the tendon. And so if you are suspecting, and someone may suspect that you have a severe condition, a severe case of this particular condition, they may send you for an ultrasound to get that quick diagnosis, that quick look.
Yeah, good luck getting an MRI for tennis elbow. Chances are not likely you'll get one. But what you would see would be, depending on if T1 or T2, you would see the inflammation in that area, and you might be able to see the striations, or if there's a little bit of tearing there on that MRI. So what the heck do you do for this?
Yeah.
What do you
And
do,
so
Dr. Dan? What do you do?
yeah, I mean, I was kind of, this condition, this was actually the first condition, Dr. Roach, that I've ever diagnosed. Like
Nice.
in anyone, this tennis elbow was the first condition I've ever diagnosed because when I was in undergrad at St. FX, I took a few courses, diagnosis courses, with a great athletic therapist over there. And we learned, special tests, ways to diagnose using our hands and putting pressure and touching specific areas. Um, and so I feel very attached to this condition. It reminds me, it takes me right back to when I first started doing this. Um, but yeah, no, light weights are actually good, contrary to popular belief. Um, Controlled contraction of the musculature. And so either eccentric loading of the muscle, which is when you're slowly, like if we're working on the common extensor tendon, where if it does this, eccentric loading would be slowly lowering with weight. So you're lengthening the muscle, or you
Yeah.
can do slow concentric exercise where you're shortening that muscle. So you'd be slowly extending or lifting your wrist.
So one could simply get a dowel, like a wooden dowel, and tie a rope to a weight
Yeah.
and just basically bring your wrists up and down, right? So that would be a very easy way to create a little bit of an exercise rehab type program for epicondylitis.
Yeah, yeah, and definitely another easy exercise too would be just to squeeze like a stress
Stress ball.
ball.
Yeah.
Yeah, just squeeze a stress ball and then flex and extend your wrist at the same time, right? And a lot of people think, oh, if I'm gonna try and fix this issue and I have to do strengthening, weight strengthening, don't you want me to be moving my elbow? No, actually, contrary to popular belief, it has nothing to do with moving your elbow. These muscles all act on your wrist. And so all you have to do is wrist exercises to help with this condition.
Yeah, and you got to realize that those two muscles, the extensors, the ones that attach to the epicondyle and the flexors, they don't cross the elbow joint, right? They just attach at the radius or ulna. They don't attach to the humerus. So that's very important to realize that.
Yeah. So the second thing that I would be doing is stretching, right, as well. So even if you're loading and working on this, you want to be able to stretch it out. And so one of the best stretches that I like to do for, if this is a wrist extensor issue, if we're talking about tennis elbow, is just bringing the two hands together. We call this reverse phalanx. And so you're just stretching the top, right? You're going in the opposite direction. And then if you want to stretch the golfer's elbow, right, you just do the complete opposite. You're just bringing the hands together as a phalanx like this, just to get a good stretch in on the inside here of that elbow there.
Yeah. What else? Yeah. So lifting properly, very important. Definitely keeping your wrists rigid and using the bigger muscles, just like we always tell people when they're lifting something heavy to lift with their legs and not their lower back, right? Mm-hmm. Using your legs because the muscles are bigger there. Muscles are bigger in the top part of your forearm than what they are at the wrist. So keeping your wrists stable will keep the muscle stable so that you actually can lift with your arm, your bicep and your tricep where the muscles are a lot bigger.
I've also got here nerve, so just like we were talking about earlier, you can't just look at the muscle. You have to also look at the nerve to make sure that it's moving properly. We talk about things like nerve flossing. And so this is when you're actually trying to target and move the nerve back and forth through the tunnel in which it may be entrapped. And so you want to get that mobility in there because if you're moving the nerve, you're feeding it with blood flow. Whereas if the nerve stays stagnant, just like a joint, it won't receive that healing process, that factor. And then what will happen is you'll continue to get symptoms and they'll actually get worse. So you have to keep feeding that nerve properly. Some things that you can do with this condition is do a little bit of trigger point therapy, just go in the muscle and try to get that. If there's any scar tissue that may have developed, try to break that down a little bit, get that inflammation out of there, and encourage that blood flow. And speaking of encouraging blood flow, there's something that we offer in the clinic as well that's really helpful in doing that. And that is the laser.
Yeah. Yeah, laser is going to basically penetrate the skin and be able to go to a depth that is almost impossible to go to when you do stuff by hand. So one of the things that Ben and I do by hand is called active release technique. So we basically take the muscle, we shorten the muscle. If we're working the top part of the forearm, we take a tension on the muscle while the person is actually shortening the muscle, and then the person lengthens the muscle as we hold that muscle. So the best example I can give you is almost like if you crumbled a piece of paper, you put your thumb on it and you pulled the paper. What you're going to do is you can take the wrinkles out of the paper. That's what active release is doing. Many times, though, the condition can be very chronic, and there's a certain amount of inflammation that's there that if you put your thumb on it, it's almost like you're putting pressure on a bruise all the time where it's not going to heal. So sometimes the chronicity makes it such that you should start care with laser, which is going to basically bring tons of oxygen to the cell, bring new blood flow by causing vasodilation. You're going to expand the vessel diameter where more blood's going to get to the area, and you can supply that area with new blood flow, which has been taken up and couldn't get there because of the amount of inflammation that was in that elbow. So sometimes laser therapy cold laser is very, very useful to get the condition going. But then we also have to work the soft tissue, because you got to remember the reason the inflammation was there is because there was a muscle problem at that area. Mm-hmm. And I just wanted to mention that one of the diagnostic tests to figure out if you have carpal tunnel or not, one of them could be just a very simple resisted extension. So when a person has a golfer's elbow, there's a test called, I believe this one's called Cozen's, where you basically resist extension. So you tell the patient, hold strong as you try to bring the wrist down. And all of a sudden they'll say, oh, my elbow hurts, right on the outside part of the elbow. Or the other way around, if they flex their forearm and you try to they try to resist you bringing their wrist down, it'll hurt on the inside because you're activating the flexors. And on this one, you're activating the extensor. So a very simple test that if you're married, you're with somebody, you can actually, not that you should do that, but maybe try to diagnose yourself and then make a call to the chiropractor.
Yeah, for sure. For sure. What else did I write? I said ice too. You can always try icing the area, right? If you were looking for a quick fix, right? Reduce the inflammation, get that stuff flushed out of there.
Ever put heat. Okay.
Yep. Never, ever heat this condition. Never.
Steroid injections. We already talked about steroid injections. Try to avoid that. Connect with your chiropractor. Please try to avoid corticosteroid injections in the elbow. All right.
Yeah. Did you want to kick this one off, Dr. Roach?
Yeah, sure. So basically, there's research that's been found that people with weak rotator cuff muscles have a higher propensity to having elbow pain. So rotator cuff muscles are very important because most of them rotate the arm externally. This is inwards, this is externally. So there's research that shows that there's a higher propensity to elbow problems with people that have poor rotator cuff muscles. Also, young kids that have a rounded back, and my gosh, we're starting to see a lot of those because of how much time kids are spending on their video games. I'm not an enemy to video games. I'm just saying that there has to be a moderation, right? Parents, you got to limit it, okay? We're starting to see lack of cervical curves in kids 8, 9-year-olds. So 8 to 9-year-old kids coming in, no cervical curve left in their neck because of how much time they're spending with their heads down. So what happens, they start to be kyphotic, they start to be rounded. And research also shows that there's a link between people that are rounded and elbow pain, specifically with baseball, people are throwing. Go ahead, Ben.
Yeah, they're 2.5 times more likely to develop an elbow injury if they have this kyphosis or rounded back. If you think about it, these muscles aren't in favorable positions when the shoulders are rounded forward and the back is more curved. The muscles have to work much harder to pull the individual into the proper position. So what they're just going to say is, you know what, we're going to save energy, and instead we're just going to keep them in this position. What happens is our stabilizers for our shoulders become very weak. And then when it comes to throwing, right, if we're a throwing athlete, all of this force. They have no stabilization through their shoulder. And so where's the stabilization going to come from? From the elbow. And so
Right.
then the elbow has to work way harder than it usually would to produce a nice throw, a nice far throw. And what ends up happening is we get these elbow injuries at a very, very, very young age.
So let me just show this. So when you take a look at the cocking phase, that's basically where the arm is basically creating the most stored energy, right? It's like a spring. It's all the way back, ready to be moved forward. Look at the spine here. This is what we call extension. So the back is arching backwards. Well, a rounded back cannot do that, right? So when the arm is coming back, the spine has to be able to extend backwards. If it cannot do that, all the forces, what Ben was saying, has to come from the elbow. So the elbow reaches further back because the back is not going there. And all of a sudden, you have a ligament here called the ulnar collateral ligament, the UCL, that goes, and there's a snap that occurs, and the ulnar collateral ligament, the ligament on the inside of the elbow right here, tears.
Yeah.
And if some of you watch baseball, that is called Tommy John surgery. And, you know, they've gotten better at doing Tommy John surgery. So it's not the career breaker that it used to be, but the arm is never the same and definitely could be avoided because we get it all the time. Why should I bring my kid to the chiropractor? Well, here's a very great example of why.
Yeah, totally. If you improve that thoracic kyphotic angle, if you improve that curve and through the mid back, the results show that there's 3 times less. That's 3 times less of a chance of suffering an elbow injury if you're taking care of that kyphotic angle than if you weren't taking care of it at all. And so that's a beautiful connection between what it is that we do right at the spine and its immediate effects on improvements in mobility at the elbow joint. And just something else, and this is just food for thought, but in baseball players, there's a crazy association with the amount of hip rotation, internal rotation that you have, and Tommy John surgery. So it just goes to show that kinetic chain and its importance from ground reaction forces all the way at the bottom to the elbow producing force all the way at the top.
So let me take it even further. You see his foot right here? That is the big toe. The inability for the big toe to be able to extend. So when you're standing and you take your big toe and you bring it up, you can even have your partner pull up on the big toe and see how much pliability there is. There is a huge correlation between your ability to extend your big toe or the inability for you to extend your big toe, and which is highly prevalent in people that get older and get arthritis in that big toe and it starts curling in and you got that big, you know, hump on the side of the big toe, to your ability to be able to rotate the hip and low back pain. Now, when all of this is happening, shoulder and elbow become the symptom and not the cause. So guys, kinetic chain, your ability to accept ground force from the ground up needs to happen at every single joint. And if it does not happen, you will have what we call a non-traumatic injury. An elbow, you know, ulnar collateral ligament injury is not a traumatic injury. All you're doing is throwing a baseball. Nobody hit you. You didn't get hit by a car. It's non-traumatic. And it evolves because of things not being corrected, like your big toe, like your knee, like your hip, low back, all this stuff. All the rotation happens right here after the hip at what's called your TL junction, your T12L1. All the torso rotates at that area. Well, guess what? That is a major area that Ben and I find all the time that isn't moving well in people. That is a huge thing. So guys, please give us a thumbs up if you've learned something. That is a great way to explain basically all the hump day conversations that we have done and everything that we've talked about on the kinetic chain. Does this make sense? Give us a heart.
I love the kinetic chain. Like this is like some of the coolest stuff that I'm such a nerd over. Like the minute that I start talking about the kinetic chain and like how this affects that big toe and all the way up to the hand. And then people think that I'm crazy. And then I explain it. And then they're just like, whoa, you're totally not crazy. That totally makes sense. Well, this is how the body moves. Everything is connected by fascial networks and nerves and muscles. I mean, this is really primo crazy stuff.
And by the way, if you think chiropractic is still in the Stone Age, this is the reason why every single professional sport team has a chiropractor. And most of the top dogs in the sport that are being paid, 10, 20, $30 million a year, whether you like that or not, it is true. A lot of them have their own personal chiropractor because maybe they choose not to see the team chiropractor because they have their own that they trust, right? So chiropractic has come out of the Stone Age and is by far probably the people that are most effective at making changes in that kinetic chain and increasing performance in professional athletes. So if it's good enough for them, guess what? It's good enough for Mary, who's 47, working at Bell or working, gardening, or the guy that's driving a truck. Kinetic chain is kinetic chain. It doesn't really matter. We're all bipedals. We all walk on this planet. We all have, we're forced to accept ground force as soon as we step foot. And we all need to have these joints working in hand together.
That's right.
This is probably my best Hump Day conversation. I love this one. This is where we put it all together.
I thought you'd like this one. I was about to say, even patients who just want to improve their golf game, like weekend golfers, I love talking to them about, the kinetic chain because they appreciate it so much. They said, I've come here for my back pain. I didn't realize, that if I just improve my hip internal rotation on my lead leg, that it could save my back and keep me golfing for like an extra 5 years if I just improve my hip mobility. It's absolutely it blew me away when I first heard it. But I mean, now that I see it in clinical practice, it's just like.
And once you explain it, the patients are like, well, duh, now I get it, right? Yet everybody's been treating the elbow, or everybody's been treating where the fire is. And we got to get away from that, pin the tail on the donkey and just treat where the pain is. We got to take a look at the overall thing. Omega-3, very important, anti-inflammatory. We talked about inflammation, right? Epicondylitis, it's an inflammatory condition. Tendons get inflamed. So omega-3 is just a good way where we are replenishing our body with stuff that kills off inflammation, because we're not always perfect. We do stuff, we garden, we do all these things. And definitely taking an omega-3 from a great source like these NutriC products, which are fantastic, by the way, regarding the omega-3. We talked about the omega-3s becoming rancid. And the reason they become rancid is because they're all in big barrels and they get exposed to oxygen, and because of oxidation, they become rancid. So when you're burping fish oils, that is not a great product. You should not burp anything. It shouldn't come back to haunt you. It shouldn't smell. You should be able to break the capsule open and not have that, fish meal smell that's just not good at all.
That was a good Hump Day conversation.
That was rock on, good Hump Day conversation. So guys, let's do this right now. Let's have everybody on the count of 3 hit that share button right now. This is worthy of being shared. This is some of our best work.
Yeah, this is great Hump Day conversation. I was about to say, even the treatment slide alone, like if you have that tool, that treatment slide alone is a huge help in reducing, greater than 50% of that symptomatology.
And by the way, chiropractors don't just adjust vertebrae. They adjust extremities as well. Wrists, where there's a joint, a chiropractor can move it. I will say not every chiropractor adjusts extremities. Dr. Ben and I do a lot of it, actually. And so on the count of 3, everybody press share. 3, 2, 1.
Share.
All right. If you're watching this on YouTube, click subscribe. All right. And then I think you can actually share YouTube video too.
Yeah, you can share YouTube video. You can also post YouTube videos to Facebook. So there's tons of things you can do with YouTube videos that is absolutely Awesome. I was about to say, when we were talking about special tests earlier, I was about to say, you can test for tennis elbow by lifting the middle finger. It's called resisted middle finger extension, because that radial nerve passes right underneath, and that pin, testing for that. So it's really cool. Yeah. Resisted middle finger extension.
Give us a thumbs up if you enjoyed this presentation tonight. Another hands up would be great. And we look forward to next week. Again, we're going to do a few little promos there. We want to have a lot of people live on that Facebook Live, because anytime you bring a guest on, they are doing this for free. They like it when there's a lot of people on there asking questions. We want to make sure that you guys show up big. Okay, so make sure you show up, and we will make sure that he gets a great welcome, East Coast welcome. This guy here is from Texas, so we got to give him a good maritime welcome. Next week, 9 o'clock, Wednesday, Hump Day Conversation number 29. Ben, last thoughts, buddy.
Thank you guys so much. We had a lot of fun tonight. I hope you guys did too. Excellent topics. If you guys have any questions, if you guys have any future topics that you want to hear about, comment below. We definitely want to be able to hear from you guys and have this open dialogue, and come ready with your questions next week. Yes, go Habs, go. Yes, Alex. Oh. Yes. So yeah, we definitely want to hear from you guys, and let us know. Give us some feedback. We love it.
Guys, thank you so much. Have a great rest of your week. Weekend's coming up. Apparently it's going to be nice. Take care. Have a great night from Dr. Ben and I. Thank you so much for supporting us and watching these lives all the time. We got people that have been live for all 28 episodes. Ooh. Thank you. And we'll see you next week. Cheers. What's up, guys? Listen, if you like this episode, you'll probably like the other ones. Chances are pretty good. So here's what you need to do. You need to like us and follow us on Facebook. Following means you get notified when these two guys are live. Next, family, friends. You need to share these episodes, because you never know. You might help them, because they need this information as well.
And guys, if you ever miss an episode, make sure you subscribe to us on YouTube. That way you can watch the episode over and over and over again.
Guys, we love you and appreciate you.
Take care.